Good morning, everyone. This is Dr. Vliet, and welcome to America's Fabric. Today, I have my guest, Dr. Hatfill, back with us to talk further about the emerging diseases and these viruses that people are confused about. Just exactly how do they work, what do they do, why are they a risk, and what do we do to protect ourselves? And for those of you listening new to the show who missed the previous one, Dr. Stephen Hatfill is an American physician, scientist, virologist, and bioweapons expert who has a background in military special operations and training in emergency and tropical medicine and pathology. He obtained separate master's degrees in microbial genetics, radiation biochemistry, hematological pathology, and has multiple published research papers, and also was awarded the U.S. Army Parachute Wings in 1975. He has postdoctoral fellowships at Oxford University, the National Institutes of Health, the National Research Council, where he studied the Ebola virus at the U.S. Army Institute for Infectious Disease at Fort Detrick. He was also certified in the year 2000 as a UN Iraq weapons inspector. He's an adjunct assistant professor at a leading university in the United States and also operates a remote jungle training facility to test new equipment and to train other scientists to conduct research in these high biodiversity areas. For the last 7 years, he has also trained U.S. Army, Navy, and Marine Special Operations units in tactical combat casualty care. He is speaking to us today as a board member of the American organization Doctors for Disaster Preparedness. Welcome again to America's Fabric, Dr. Hatfill. I'm honored to have you as my guest.
Well, thank you very much.
So today we wanted to talk a little bit more about these emerging viral illnesses. Most people have had experience with the herpes zoster virus as chickenpox in childhood, and some people then later develop a different form, expression of that virus as the disease we know as shingles. So that's a viral illness that people are familiar with. They're familiar with the flu. They've heard about swine flu, for example. And now Ebola is hitting the headlines. And this is one of the hemorrhagic fevers. So I'd like for you to talk a little bit more about the differences in these viruses, the DNA viruses versus the RNA viruses, and the hemorrhagic fever viruses, and what they do that's different from what people may be accustomed to.
First of all, the viruses can be classified into two broad types. DNA viruses, which use deoxyribonucleic acid as their genetic code, and the RNA viruses, which use ribonucleic acid in their genetic code. And this is what's replicated and gives new viral particles. The herpes zoster, or the chickenpox virus, is a DNA virus. And it mutates very slowly. And there's a number of these DNA viruses. Once they get into the body, they kind of tend to stay there. The herpes viruses, I think we're up to herpes virus 8 now. You maintain these infections controlled, but you have the viral particles in your body perhaps for most of your life. Chickenpox, the shingles, is caused when the viral comes out of the dorsal nerve root ganglia, and it goes up and spreads on the skin, giving the characteristic rash. The Ebola viruses and the other RNA viruses don't do this. Once your body makes neutralizing antibodies, that's pretty much the end of the infection. Although, at least we know for Marburg patients, you may be clinically normal but still secreting live virus in your body fluids. The infection to you is over.
What does that mean for the people around you?
At least for Marburg virus, it's been documented that you can secrete live virus, infectious live virus, for I think it was around 40 days. They had a case in Germany, and the wife subsequently became infected, and I think she died.
Well, now the Canadian Public Health Advisory does bring up that issue as it relates to Ebola virus as well, that it can live outside the body for several days.
Well, it depends. As a naked viral particle, no. We know the virus goes to what we call the Langerhans cells in the skin. It conceivably, shedded skin particles might, and I say might, be a source of infection. I certainly wouldn't want to manage an Ebola patient by touching them without gloves on. Again, when we deal with medicine and things that are dangerous, we always need to err on the side of caution.
No, that's a good point, because I'm concerned when I hear doctors get up on television nationally and say there is no risk of transmission by aerosol or airborne, or, as you mentioned, the skin cells. I think in medicine it's very unwise to say things never happen.
Well, this is a premise in medicine that all physicians should keep in mind. What the people on television are talking about are the case studies. Again, aerosol transmission is a multifactorial event. It depends on aerosol particle size. It depends, the size of the droplets that are moving through the air. It depends on the competency of an individual's airway defenses and immune system. It depends on how many viral particles, which are required to initiate a human infection.
And what is that for Ebola?
For Ebola, it's a very small number, possibly as low as 10 viral particles.
Now, that's pretty significant, I thought. I was aware that the number was low, and to say that it might be as low as 10 viral particles, I think that's pretty significant.
Well, that's a very, very low infectious dose of any disease agent. Again, the statistics that have been gathered in these rural types of outbreaks have not really focused on aerosol transmission as being a risk factor. The risk factors are actually contact with infected patients without wearing gloves or protective gear. And again, in a lot of these African areas, there's certain things that are very precious to any human society. These are births, marriages, and deaths.
Yes.
And most cultures have very specific protocols for approaching these type of life events. In some parts of Africa, the families take the deceased body away. It's washed and prepared for burial. There's a lot of touching of the corpse. If you're not wearing gloves, everybody has tiny microscopic little cuts on their hands, and this is a fairly common way to pick up Ebola, shown by the case studies. So eating bushmeat or capturing animals in the wild.
So bushmeat, for those who are living in the U.S. and don't realize the term bushmeat, are wild animals.
Yeah, wild animals. We have to remember that Ebola's been breaking out very frequently over the last decade or so. In fact, over the last 5 years, it's really been decimating the wild gorilla and chimp populations in the Republic of the Congo.
And we haven't heard much about that because it's an animal population, but that's significant too. Very
significant. What we've been able to determine from this is that, RNA viruses tend to make mistakes when they replicate. And some of these mutations are retained. The RNA viruses tend to genetically drift with time.
And that, in common layman's terms, that genetically drift over time means that they mutate and change. And as I understand it, RNA viruses are more rapidly changing over time than, say, DNA viruses.
Oh, yeah, DNA viruses are fairly stable. RNA viruses tend to make a mistake every time they replicate.
Interesting.
And it gives you a lot of non-infectious viral particles, but you're dealing with so many, sometimes these things can change their their innate properties with regards to transmission.
Well, do we see some evidence now with these Ebola outbreaks that are being reported that there have been these types of changes in some of the strains that are making them perhaps more virulent than they were, or not?
I don't know about virulence, but genetically, the original outbreak of Ebola was the Mayinga strain in 1976. It remained fairly quiet. There was a simultaneous outbreak there. If your listeners are interested, Dr. Glenn Close wrote a book called Ebola. He's the father of the famous actress.
Ah, interesting.
Yeah, that was his mission hospital where this first broke out. Kitwit in 95. These were all the oldest lineage groups that we call Group A. The samples that have come out of the Congo, the GOR1, GOR2, the Kata, these were Group B viruses. And now as this disease has sort of shifted a little bit more into eastwards, we're starting to see the Group R viruses, the Madimba A and Madimba B.
And those are some of the ones we're seeing now?
I'm not sure what the isolates are showing in this current outbreak. These things have to be genetically sequenced. Ivory Coast had a unique one called the Thai forest strain. This is just the way Mother Nature works. She's always experimenting and always trying. What is a little disturbing is that this is such a large outbreak, and it's cycling through so many human cases that we would expect to see some genetic differences from our known strains.
That's what I wondered about. And you also mentioned that the Ebola virus outbreak now has been transmitted by bats, I believe.
This is very interesting, and this is really the work of Dr. Bob Swanepoel and some others. Dr. Swanepoel's in the Virology Institute in South Africa. And he's been looking for the animal vectors of these diseases for most of his career. I consider him one of the really true experts on this. And what's happened for the filoviruses, both Marburg as well as Ebola, is that we're picking it up in 3 species of fruit bat. Now, these aren't the guys with the nasty teeth. Fruit bats are kind of like the flying foxes. They're actually kind of cute. And a 2001 to 3 expedition, these bats are trapped and blood samples are taken, they're released. But this expedition to Gabon in the Congo found some RNA sequences of Ebola in these bats, and this was in a region where they'd had a gorilla die-off. So both Marburg and Ebola, if you look at human populations, you can find about a 10% what we call a seropositivity in these populations where they've been exposed but to less than an infective dose, but they still make antibodies. And we find these bats in these areas. The bats are Chiroptera, and funny enough, they're probably the most biodiverse mammal species on the planet. If I remember right, there's about 1,115 different species, and they've been around humans for year after year after year after year. They're a real old lineage. And we're finding a lot of weird viruses that can infect humans come out of these bats. There's a rabies virus that, or member of the rabies family of viruses, Bas Congo, that causes hemorrhagic fever. They can transmit some other really strange things like the Hendra virus in Australia. So bats are quite a concern here. And in fact, from 94 to 98, non-Ebola type viruses, we've had 4 emerge. The Hendra virus, something called the Menangli virus, Nipah virus in Malaysia, and the Australian bat lyso virus. So these are sentinel animals that it's a good idea to kind of monitor and trap and take blood samples from.
Well, that's really fascinating. As a biologist before I went into medicine, that's definitely fascinating. I wanted to ask you to talk a little bit about, before we finish today, I'd like to talk more about what you were describing, or beginning to describe in our last show, about exactly how the Ebola virus and the hemorrhagic fever viruses attack the body?
A virus to enter a human, and we're exposed to thousands of viruses a day. Most of them are not infectious to us. For a virus to be infectious to a human, I call it the lock and key theory. There has to be a protein on the outside of the virus, that's the key, and it binds to a different protein on human cells, that's the lock, and if the key fits, the virus enters the cell. Now, viruses are very primitive. I mean, whether they're chemicals or life forms is still a matter of much debate. But the virus can't replicate on its own. It doesn't have its own machinery. All that it has is the genetic code that specifies how to make more viruses. So it takes over the cell's machinery and uses the cell's own biochemistry to make more copies of itself. And very often it ends up killing the cell in this process, and that's what the Ebola virus does. Well, the Ebola virus is able to bind to a lot of different cells in the body, starting with your normal white blood cells that are responsible for some of your immunity. The virus will secrete an outer glycoprotein, we call it 125 kilodalton protein, and this can bind to your neutrophils and disrupt their function, your white blood cells' defense.
And so the macrophages that you mentioned the other time we talked.
These are critical. These are critical. The macrophage is central to producing the Ebola disease. That and the fact that it can bind to human blood vessels. What happens with the macrophages, these are sort of master scavenging cells, and they're designed, if they see something unique in your body, to gobble it up and process it and present it to other cells called lymphocytes. That's their normal function. And the Ebola virus loves to replicate inside the macrophages, and this is how it initially spreads around the body. Well, Ebola-infected macrophages aren't very good at their job of stimulating your lymphocytes, the cells that are really, really good at coming in and killing viruses. And in fact, if we're looking at the Ebola Zaire strain, the Ebola virus is able to actually kill these cells. And what we see is the patient gets the general flu-like symptoms, and then suddenly they start developing clinical signs and symptoms. And this is right at the time that the Ebola virus is causing their lymphocytes to die by a process called apoptosis. And we see this in some viral diseases. The HIV virus does this. Although these CD4 and CD8 lymphocytes aren't infected, they come in contact with one of the proteins and they kill themselves. So the macrophages is doing that. And then it starts to release a lot of what we call inflammatory molecules.
So it creates a lot of inflammation throughout the brain and the body.
Well, it inflames all your tiny little microscopic blood vessels, all your smaller blood vessels throughout your body. And this leads on into the systemic inflammatory response syndrome. Your readers can Google SIRS, or multiple organ failure, just like in toxic shock. In addition, they release a substance called thromboplastin that gets your coagulation system all going, and you start using up your own clotting factors. And
then your blood can't clot and you bleed.
Right, and that's the hemorrhagic portion of the disease. And we know that this comes through two primary pathways. These infector macrophages release viruses that get into the endothelial cells and make them dysfunctional. It releases this tissue factor, or thromboplastin, that gets the coagulation system going. And we know that some of these inflammatory molecules can inhibit what we call TF7A. This is one of the clotting factor complexes. So what it does is it kind of amplifies this inflammatory response, and your blood runs out of clotting factors, and you enter something called DIC, or disseminated intravascular coagulation.
Yes, and that's devastating, and that's what I've seen back in my years of training and working in the hospitals.
Oh, yeah.
And it's just so severe. I really think it's important for people to understand exactly what the viruses can do so that people can be more proactive in taking some of the common sense preventive approaches that we know help us stay healthy.
It's not something I worry about in the United States, but I'm just in the habit of kind of just taking basic measures so I don't catch the flu.
Well, list those, because I think people need to be reminded of it.
Well, just, we touch our face or scratch our nose. I forget how many times a day. And I've just gotten into the conscious habit of not doing that. I take my shoes off when I come home because they've been tracking around all over everywhere and in hospitals and everything. I wash my hands is the first thing I do when I get home. And we don't need to be worried about Ebola because scientists have gone in and cultured the bacteria in just normal houses, and they find a high incidence of these multi-drug resistant staph germs.
Yes, you're right. Even on our cell phones and all these things that we touch out and about.
Surfaces everywhere.
Yeah.
So basic precautions. A good deal of the chicken and the pork in the supermarkets is contaminated with several different gastrointestinal disease-causing organisms. We handle this food in a common sense manner, prepare it in a separate part of our kitchen, and constantly we'll wash our hands and wash our work surfaces. These are just basic hygiene measures. And it protects against the flu as well as minimizes Ebola.
Well, and also carrying the hand sanitizer and when you're out and about and just being sensitive to that. I think all of these are such common sense things. And I encourage my patients to not smoke and don't drink too much alcohol because that suppresses your immune system. And there are just a lot of these common sense things we need as Americans to do more to stay healthy.
Now, the hand sanitizers are an interesting thing. We have a virus out there called the Norwalk virus. This is the thing that breaks out on the cruise ships and everybody gets gastroenteritis.
Right.
And the alcohol-based hand sanitizers don't touch it.
Oh, no. So all these hand sanitizers on cruise ships are not doing anything.
That virus doesn't have a fatty envelope. So the alcohol-based products really, don't do anything. And this is probably our most common form of gastroenteritis.
Oh, my God.
So you need to get a hand sanitizer that's not ethanol-based.
Okay. Well, we'll leave people on that note today. And what I'd like to do is have you back to talk further about what we're learning about Ebola and some of the new treatment options and this new medication, ZMapp, that people are beginning to hear about. So thank you again for joining us today. I look forward to having you back to talk further about all of this.
Well, thank you very much. That sounds like an exciting discussion.
Okay. This is Dr. Vliet signing off for today. Thank you for joining us on America's Fabric. Follow me on Twitter at Health and Sense, CENTS, or my medical website, www.herplace.com. Be well, stay healthy, and enjoy your days until next week.